especially in countries with high birth rates, are encouraging family planning and birth control among their population. Family planning simply means that a married couple plans when they want to have a baby and how many children they would like to have. If there were no birth control and family planning, countries like China and India would be overpopulated. For example, Singapore, through the Family Health Service of the Ministry of Health, promotes family planning in order to get Singaporean couples to have more kids. If a couple does not want to have a baby, they must prevent a sperm from joining with an egg. This is called birth control, or contraception. Contraceptive methods can be classified into two main groups. One is the temporary method. It allows couples to have children when they wish to. The second method is the permanent method, or sterilization. With this method, a couple will not be able to have any more children. From previous sections, we have learned how the sperm produced in the testis travels through the sperm duct to the urethra and is deposited in the uterus during sexual intercourse. The ovary releases a matured egg into the fallopian tube. The sperm will move up to the fallopian tube to fertilize the egg there. Fertilization can thus be prevented by making sure that the sperm does not reach the egg in the fallopian tube. There are several ways to achieve this. Click on the repeat button to review the introduction. The sperm is created in the testis, and the sperm duct is the only tube that links the testis to the urethra. Using surgery called vasectomy, the sperm ducts in a man can be cut and tied. This is a permanent contraceptive method. After the male sterilization, sperms cannot pass through the duct. This way, no sperm is deposited in the uterus, so no fertilization can take place. Another method of contraception is the use of condoms. A condom is a sheath of a very thin latex that traps the sperm during ejaculation, so they cannot enter the vagina. Condoms have one particular advantage over all other contraceptive methods. They provide almost complete protection against sexually transmitted diseases because they form an impenetrable barrier to the bacteria and viruses. Click on the condom button to learn about the two male contraceptive methods again. A barrier can be put on to prevent the sperms from reaching the egg in the fallopian tube. A diaphragm, or cervical cap, is placed into the vagina so that it covers the cervix, which is the opening to the uterus. The diaphragm is a shallow, dome-shaped latex cup with a flexible rim. It fits into the vagina and over the cervix. The cervical cap is made of latex, is thimble-shaped and smaller than the diaphragm. It fits snugly onto the cervix. They block the semen from entering the cervix. Diaphragms and cervical caps are soft rubber barriers that cover the cervix. A diaphragm measures about 6 to 10 centimeters across. It is made of thicker latex than condoms and surrounded by a flexible rubber-covered metal ring to keep it correctly positioned in the vagina. As the size of the vagina differs from woman to woman, a diaphragm has to be fitted by a doctor. If it is not fitted properly, it will not completely seal off the entrance to the uterus. So far, the contraceptive methods only seek to stop the movement of the sperms towards the fallopian tube. There is another form of contraceptive called the spermicide. It is a substance that kills sperm. It comes in the form of creams, jellies, foam, and tablets. It is best to use this together with condom, diaphragm, or cap. The spermicide must be applied to both sides of the diaphragm or cap or condom. The diaphragm must be left in place for at least 6 hours after intercourse.